Is becoming an ambulatory care pharmacist a good career choice? And more importantly, is becoming one worth it? We're going to be talking about satisfaction, salary, the job demand, and the flexibility of this career path for pharmacists. If this is your first time here, welcome. Hey, this is a channel where we talk about all things pharmacy careers, job market, job trends, and anything else that tickles our fancy. In this video, we're going to be talking about these details and more. So if you like this kind of stuff, hit that subscribe button like you're hitting all your past childhood trauma, like you're beating it up and you're like, yeah, take that childhood trauma, I'm cured. So what is it? Well, ambulatory care got started around in the groovy 1970s. Ambulatory really just means the ability to walk. Why they didn't call it primary care pharmacy, why they didn't call it outpatient pharmacy, I don't know. Pharmacy always wants to be different when how we name things. But ambulatory care pharmacy really just means handling disease states that are often seen within primary care clinics. We're talking diabetes, chronic conditions, heart disease. We're talking a lot of the common things that are seen practically in every primary care facility. These are pharmacists who kind of act like specialists that just focus on the therapies that need to be provided for chronic diseases within primary care. They work in collaboration with caregivers, nurses, PAs, NPs, doctors, and of course, every other kind of specialist under the sun. They work in outpatient clinics, physicians' offices, hospitals, health systems, and even in community pharmacies. They have job titles like clinical pharmacist, ambulatory care clinical pharmacist, ambulatory care specialist, clinical pharmacy specialist. Who knows? It's always different at every place. There isn't exactly an accurate number of the people who practice ambulatory care medicine, but we do know from the Ambulatory Care Pharmacy Specialist certification that there are just over 6,000 certification holders for this specialization. That makes me tend to think that there's probably around 12,000-ish pharmacists practicing just ambulatory care pharmacy. This was my job before I became the Happy PharmD. I was practicing as an ambulatory care pharmacist, and it was my dream job to be one. Things change, dreams change, and I'm glad to not be doing it anymore, but it doesn't mean that you wouldn't like it. In fact, this is a well sought after job in the marketplace. Because let's talk about salary. Just because I didn't like it though doesn't mean that you won't. In fact, ambulatory care pharmacy is one of the highly sought after roles that we've observed students say they want to do once they get into the practice setting. And so what's on top of a lot of people's minds is, well, how much do you get paid? Well, according to our research, actually, before I share, what do you think the average pharmacist gets paid in ambulatory care? Just comment right now. Say 120K, 150K, 200,000. What do you think? Pause. All right, did you make your guess? Well, according to our research, it highly ranges, but you can expect it to be somewhere in between 100 to 170. When I was hired as an ambulatory care pharmacist, my starting salary was exactly $113,000. Now, I worked for the VA and the pay structure was very nice, so it went up eventually at ending at $136 when I left. According to salary.com, the ambulatory care pharmacist pay range goes from $143 to $162 with an average of being $152. Not bad. Ambulatory care presents a lot of different avenues that you can go and pursue within the career, but typically the way people make extra money is through side gigs. So continuing education, expert witnessing, consulting, research, maybe even in academia. There typically isn't a whole lot of opportunities for like advancing in your career. Like you may become a manager of ambulatory care pharmacist and you could climb the ladder that way, but there's not a whole lot of different things that you can do to really advance your career. There are some options to get dual roles. Some ambulatory care pharmacists become like a professor at a college and then ambulatory care pharmacist within a setting, and that provides some flexibility. A 50-50 job, but actually they become 100-100 job eventually and kind of stressing those pharmacists out. but it's a possibility. So for the salary score, I'm going to give ambulatory care pharmacist a 8 out of 10. Now let's dive into the satisfaction part. Pharmacists in ambulatory care report high levels of satisfaction. The National Pharmacy Workforce Survey, which is done about every 4 years, has consistently shown ambulatory care pharmacists to be very happy in what they do. Practically everything that's negative is lower in comparison to other pharmacy settings, and everything that is positive is higher in comparison to other settings. For example, work exhaustion was a 2.7 out of 5, so about half of the people are somewhat exhausted by their work. Although professional fulfillment was quite high, a 3.4 out of 5. And the intention to leave was second lowest out of all professions of a 1.7 out of 5. Mail order pharmacy being the lowest attention to leave. Job stress was somewhat high, around 2.8 out of 5. And job satisfaction was fairly high, a 3 out of 5, although not as high as I would like to see it. So these are moderate levels of satisfaction and moderate levels of job stress in comparison to other professions. Although interestingly, one thing that I saw was that only 60% of pharmacists felt like they actually belonged in their employer setting in the DEI section of the survey. So this kind of tells me that a lot of pharmacists feel somewhat like they're a part of a system, but maybe a slightly separated, not totally feeling like they're within a corporate setting. Anecdotally, I can say that a lot of ambulatory care pharmacists kind of feel like a little different, little bit of an outsider in their work settings. They're working with other providers, physicians, nurses, and many times they don't exactly know or understand what they do. And it is a little bit hard to assimilate. It's not impossible, and many pharmacists like that kind of challenge, but it's something worth noting. I always like to go to anecdotes, and we know that a lot of our pharmacists who transition into AM care from our success stories really enjoy it. But what about unverified Reddit users? Well, a common theme that I'm seeing from a lot of places is things like, this is a great setting for people who really love direct patient care, people who enjoy their weekends and holidays off, and people who are willing to work with people and get into the nitty-gritty of solving their health care problems. Some quotes that I picked out from pharmacists who commented on the ambulatory care setting was, I am personally loving my job right now. And not a cushy job, just a different kind of stress. For instance, the number of patients you need to meet per day. And another said, I have never felt useless in the clinic. We looked at a few healthcare systems that we know employ ambulatory care pharmacists, and we know that a lot of these reviews are not just by the pharmacists, but in general, we found them to be rated somewhat higher than many other pharmacy organizations. If you're interested in getting into the ambulatory care setting, and maybe even you're from retail, check out this interview with a pharmacist who we helped go from retail to AM care setting. And if I'm not mistaken, I don't believe she had a residency, but I could be wrong about that. So given all of these factors, and given that pharmacy is often always about patient care and helping people, this is a direct role where you don't really have to dispense things, you don't have to deal with insurance typically, and you get to help people with their actual health problems. I'm going to give the satisfaction score a 8 out of 10. All right, so let's talk about demand. Are these positions actually available? So you may be wondering, are these jobs actually in demand? Like, are there tons of them? Well, you may be a little bit disappointed. There isn't a whole lot of ambulatory care jobs. Residency programs are created, and they are created to train in ambulatory care pharmacists. Residency programs is they create their next employees. So they take the program and then they get hired on by the company. And then it's the people who take the program afterwards that have to go out and seek a job at another place. But according to actual numbers, we looked on Indeed and we found that about just over 1,000 ambulatory care pharmacist jobs are available. And about 70% of them were entry-level jobs. So almost just 700 jobs only required entry-level. Many of these jobs do require some sort of residency. They could be a PGY1, and now they're being even pickier to be requiring a PGY2. I see this field as growing more and more, but not at a steady pace like community or hospitals are growing the pharmacy job market. We're talking about a handful of jobs across the United States. It's not a lot, but it's something. There are sign-on bonuses, so these jobs are typically hard to hire for. Recruiters are still in the pharmacy industry, and they often are focused on these very specific, highly trained jobs looking for PGY2 trained pharmacists. Interestingly, back in 2019, the Bureau of Labor Statistics was predicting a decrease in the pharmacy job market, as in the number of jobs available would be less than back then. That didn't happen because of the pandemic. But what they did predict is that ambulatory care pharmacy was going to be the one part of the industry that was going to grow more than the others. If you just look objectively at the number of jobs that are available, community and hospital jobs outnumber the ambulatory care jobs on a scale of 20-1. There just isn't a whole lot of these things, but there are some, and so I think that the demand over time is going to increase. And there is some evidence of sign-on bonuses being present for these jobs. We found one ambulatory care job with a sign-on bonus of $5,000, and then another job for $10,000. Given these market trends, given that I think that the healthcare model is going more and more in this direction, requiring specialties, requiring more money, requiring more time. So I think that the market will be growing bigger over the next 5, 10, even 20 years. Given these factors, I'm going to give ambulatory care a 7 out of 10. Let's look at the final section, flexibility, the magic factor about ambulatory care pharmacy. What's the work-life balance like? Is it easy to find a job? Is it easy to get into something else? Well, I like to think first about the flexibility of the role. These jobs are way more flexible than traditional pharmacy settings. You're probably not going to be working a second or third shift. You will probably not be working on weekends or on holidays. When I was working in ambulatory care, I had all government holidays off. I was working Monday through Friday, 8 a.m. to 4:30 p.m. There aren't as many, but there are often opportunities within remote positions. And the other thing that I like about ambulatory care is that there are a lot of different things that you can get into, whether it is research or academia or pharma. You're a specialist, and so it is often easy to get into other fields because of your training and experience. In ambulatory care, there's often some great perks of autonomy. You control your schedule, you can control your day. It's not true for every setting. There can be places that apply a lot of metrics and things that you have to do and check off, and that can create a lot of stress for people. But in a typical clinical setting, you get to pick your schedule, you get to pick your panel, you get to pick your patients and when you see them and how often you see them. And that allows a certain amount of freedom and independence for a pharmacist. Interestingly, we found an article in researching this video about a study that was looking at whether or not remote ambulatory care pharmacists provided enough value, and they viewed overall that this was positively impacting the ambulatory care and the clinic's ability to provide health care. And so I think that we're going to be seeing more roles in this space. I think that, of course, allows for a ton of flexibility that a lot of people want. Taking all this into account, I'm going to give a flexibility score of 8 out of 10 for ambulatory care pharmacy. So we've talked about a lot of different things. What's my final score for ambulatory care? Well, given that the salary is fairly competitive and sometimes higher than retail pharmacy, we gave it an 8 out of 10. The satisfaction was very high. In fact, one of the highest out of all professions in pharmacy. I will give that an 8 out of 10. Demand was a 7 out of 10 because there's not a ton of different jobs available in ambulatory care. And then finally, a very high score of 8 out of 10 for flexibility, giving my final score a 8 out of 10. Okay, AmCare pharmacist, what do you think? Was I being way too harsh, way too easy? Did I not talk about all the different things that are happening in the profession? It's hard to condense this all into one video, and so your expertise and knowledge is super helpful for others to give this a little bit more context. Or was I not mean enough? Should I have been harsher, a little bit more, judgmental? Probably not the right word. But what did you think? If you're interested in this career path, we would love to help you get started or go into ambulatory care or getting a better ambulatory care job that really values you and allows you to do what you do best, taking care of others and using your knowledge to help people. We would love to get started, and the best way to do that is by setting up a call with one of our career advisors to tell you more about what it's to be like working with a career coach, helping you identify your career goals, and doing so quicker than you would by yourself. We love working with ambulatory care pharmacists because you can make such a great impact in the healthcare system, and you've got a lot more power than I think most people really think. It's possible to get a remote job. It's possible to negotiate for what you want and the terms that you want to spend your time doing what you love doing, helping others. Thank you for watching this video. Let us know what other careers that you would like to hear us review. And until we see you in the next episode, take